Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we always love highlighting Campbell Clinic Foundation. We're here with our good friend, the Executive Director, Jenny Koltnow. Jenny, how are you doing?
I'm doing great. Thank you, Jeremy.
Well, when you talk about the Campbell Clinic Foundation, you all do so much good education, research, community outreach. There's a lot to unpack, but let's start with some of the basics, a little bit of history. Talk about Campbell Clinic and Campbell Clinic Foundation.
Okay, happy to. Well, first of all, Campbell Clinic has been one of the preeminent orthopedic clinics since 1909. And what has differentiated our clinic is not just the excellent care, but it's the commitment that we've had to educating people in the orthopedic field since 1924, so more than 100 years. And so really, the Campbell Clinic Foundation is responsible for facilitating education and clinical research and outreach. And we do that in partnership with the Campbell Clinic, but also in partnership with dozens of different organizations on a local, national, and international level.
Yeah, and that's what I think I want people to understand. Like, our son broke his arm, and so Campbell Clinic was there to save the day. When you talk about the foundation and all the good you do, there's a tie there, but it's separate. But there's, so much to unpack when you talk about Campbell Clinic Foundation and the research, the education, the outreach, all the amazing things you do here locally and globally. And so let's go ahead and dive into the foundation further. Talk about those three pillars and why that's so important to the foundation.
I'd be happy to. And you know what, Jeremy, I'm going to actually start with a story. So a couple weeks ago, I'm at the gym on a Sunday. My knee is bothering me, so I'm actually on the recumbent bike. And this older gentleman, probably in his later 70s, sits down next to me. And he puts one foot up on the pedal, but he's struggling to get that left foot that's on my side back onto the pedal. And so I stop, get him suited on the bike next to me, and I asked him if he needed any other help, and he said, no. He's like, I'm just glad to be here. I just had my second hip replacement in 6 months, 4 weeks ago. And I started chatting with him because I'm an orthopedic nerd and I just love to hear people's stories. But what it comes down to, and going back to, what we do at the Campbell Clinic Foundation, first of all, that gentleman was moving. He was engaged with something. And so we're really focused on moving lives, but it's more than just the physical movement. It's also about quality of life. And so in his particular case, there was a surgeon who was trained, who was not only trained in an OR, in a clinic, but has also been a beneficiary of the countless publications and efforts that we've made over the last century to train doctors, to train healthcare providers. The second part is that, if you heard me say, he had hip replacement 4 weeks earlier. He had another hip replacement this same year. And that's only possible because of research. 10, 15 years ago, when people had a hip replacement, they were inpatient. They were probably in a hospital for a week or more, and then they may have gone to some kind of inpatient rehab for weeks on end. Now, you can go home, everything, unless someone has some really complicated health conditions. The majority of hip replacements, even for elderly individuals, is outpatient. And so they are in and out in a single day, and they're weight bearing. They're walking to their car in the same day. And now, 4 weeks later, he's at the gym. And so that's only possible because we have studied and refined and really been able to create a movement around outpatient care that has, generally speaking, better outcomes than inpatient care and mitigates any kind of infections and other challenges, not to mention expense that you would have in an inpatient setting. the last part is just the outreach. And, outreach is far and wide, but really, the fact that he can be a spokesperson, that we can inspire other people to seek care, to take care of their own and protect their own movement, but also inspire the next generation is a big part of what we do. So I just feel like every success story, whether it's your son's broken arm or this gentleman's hip replacement, are all really the beneficiaries and the outcomes of really excellent education, research, and outreach.
Well, I want to touch on each one of those pieces because when you look at Memphis, something that really is special about Memphis, we are kind of the epicenter of orthopedic medicine because of Campbell Clinic. And so there's, so to speak, a Bible that kind of plays into this that everybody reveres. Touch on that piece because that plays into when you talk about research, new protocols, all the treatments, like you're talking about the advancements. Memphis is a through line for that globally.
Absolutely. One of the words we use to describe the Campbell Clinic Foundation and even Dr. Campbell himself is pioneering, because there were so many firsts here, and that's why we do have this sort of epicenter of orthopedics. Dr. Campbell started one of the first orthopedic training programs in the US and the first in the South. He started training surgeons in the 1920s. I mean, before, following World War II, he started the American Academy of Orthopedic Surgeons and the American Board of Orthopedic Surgeons and so forth. But really, as you kind of move into, current day, we've had this program in place in partnership with the University of Tennessee Health Science Center. We have, over the decades, graduated more than 800 residents and fellows. So these are people who have served millions of patients all over the United States, all over the world. And then we've also continued to produce content and information and how-tos and textbooks, including what we're known best for, which is Campbell's Operative Orthopaedics, which, yes, is considered still the Bible of orthopedic surgery.
Yeah, it's amazing. And so then let's look at, when you talk about education, it kind of plays into everything you're talking about, but you're also looking at opening access and opportunities for future. And so for high school students even, and you recently held an orthopedic career exploration day. And so talk about some of these innovative things that you're doing to open up access and opportunities, even, for high school students and beyond.
Happy to. So, we don't get future orthopedic surgeons or physician assistants or nurses or cast techs or anything by accident. We have to be intentional and we have to inspire the next generation. We have to show them the way to get there. And so 3 years ago, we started with a program that we now know as Orthopedic Exploration Day. We partner with 3 public high schools. We work with juniors and seniors who are in STEM courses, who are pre-college, and give them a really in-depth, hands-on experience where our orthopedic surgeons are working side by side with representatives of the different device companies. And they're using the same tools as you would use in the OR, the same ones that are either fixing an elbow or a finger or a hip or otherwise. We even had Smith & Nephew bring out their Corey robot, which is assisting knee replacement surgery with our total joint surgeon, Chris Holland. But it's such a special experience because we really try to make it hands-on, super interactive. They learn from the medical side and from the industry side. And then we block out time for small group discussions and to really encourage the kids to think through what steps do I need to take in order to work in this field. So we have our medical residents. We actually engage a number of the medical students from UT Health Science Center, and to really have a variety of experiences and perspectives to shed light and really kind of give kids that nudge to think about this as a career path.
And so carry that into for those who are in medical school. And we were talking before we hit record, our older son's in med school, and we were talking about different opportunities. to shadow and
Yeah.
intern and all these different paths. So you have very formal programs. Touch a little bit on that plays into this education
Sure.
side.
Yeah. So, for starters, so we have that high school program, the Orthopedic Exploration Day. Last year, we started a orthopedic summer internship where we just had our first year. We had 3 students. This year, we will have 4. Thanks to a very generous alum, Dr. Lucy King, who actually was our very first female resident. We will be able to facilitate a 6-week orthopedic internship, so intensive operative and clinical experience as well as experience working in research at UT. We work with medical students. They do rotations here. We have all sorts of research projects where they will serve on the research teams. And then our capstone programs are orthopedic surgery residency and fellowship. So these are formalized, accredited programs where we take a doctor straight out of medical school and basically over 5 years put them through a rigorous program so they can be an orthopedic surgeon.
Yeah, very cool. So let's switch over and talk about outreach because you have a
Yeah.
ton and it's everything locally to globally. And one of them are hearts to your souls. And so talk about some of the different outreach programs.
Absolutely. There's a real commitment to taking care of our local community. And, we could be here all day when I could give you examples of what teams and what our surgeons are doing on their own to work with and to really make care accessible, and to also serve so many high need patients through our partnerships at Regional 1 and Le Bonheur. But our Hearts to Your Souls is a program where our foot and ankle surgeons, as well as our fellows, will go to, in this case, the Memphis Union Mission each November. Done this for, 18 years. We will serve more than 100 of their Memphis Union Mission clients and provide foot nail care, new socks, shoes, as well as care packages, and really, sort of minister to their needs. And the program's been so well received that we've actually started a second program in this spring working with Hospitality Hub. And that program tends to be more focused on women and children. But it's a program that really has a lot of impact, but also is really meaningful because sometimes just that opportunity to engage with people and to help them, really understand how to take better care of their health is the biggest impact of all.
Give us one more that puts a smile on your face because I know there's tons and it can be locally or globally, but give us one more on the outreach side that puts a smile on your face.
Oh gosh. I think what is so meaningful is just hearing, for example, from Dr. Paul Greenfield, who just returned from a 5-day trip to Guatemala. It's just the graciousness, the opportunity to take care of people whose conditions are so, sort of standard and routine here in the US. But the lengths they go to get to a real clinic, to get care, to get their children to care. And so, in the span of 5 days, I think he said they did 52 surgeries and saw about 160 patients. And, that has really had a profound impact on him, but it will impact his care and his attention and his compassion, for his whole career, his whole life. And what's exciting too is that energy, that excitement that he brought back has prompted, 4 or 5 other junior residents to reach out and say, I want to do that. So it's that sort of ripple effect of sometimes it's not only the person who's doing the project or doing the service, but it's how they can really make that meaningful for their peers and their colleagues.
Absolutely. All of this is supported by the public and outreach, engagement with the community. So there's a lot of through lines there in terms of how the community can support Campbell Clinic Foundation. Go ahead and touch on some of those different ways.
Yeah, there are so many reasons to support the Campbell Clinic Foundation. But the first one is to really celebrate movement and celebrate mobility. It's just not something we can take for granted. Hey, we just we're in the holiday season, we're spending time with family and friends that are lots of different ages. We're having these conversations, and at some point, everything's going to hurt, or, we're going to have an unfortunate injury. And so it's both an opportunity to pay it forward, to take care of other people who might be hurting, to make sure that we have the best information and the best resources possible and available to take care of people, including maybe your mom or your sister, or your husband, or your child. But it's also important for us to look at how the Campbell Clinic Foundation sort of fills a void where no one else is there. And, one other program that I wanted to highlight is that we have a really one-of-a-kind program for children with cerebral palsy. It was launched in 2018. We have been taking care of upwards of 500-600 patients each year, but there's no other place for children with cerebral palsy and their families to get care this comprehensive, this thorough, within about 250 miles of Memphis. So it is so crucial to invest in the Campbell Clinic Foundation to not only sustain programs like that, but to also make sure that that great orthopedic care and the best resources possible are available for you and your family when you need them most.
Yeah, and I think all this plays into the larger conversation around an aging population, the growth of that, the shortage in the medical industry overall, the shortage in terms of specialists and doctors and physicians and orthopedic surgeons. And so there is a real need to support these educational programs to be able to make sure that from a sustainability standpoint, that all these generations can be well taken care of. And so there's a lot that play into not only the specialization, but also too just the sheer fact of the numbers of specialists that we need to be able to take care of our populations. I think there's a lot of important conversations that kind of play in with this, which is why we'll have to have you come back. So talk about where we can go to, follow Campbell Clinic Foundation, can take those next steps to get involved. So wrap up with website, social media, phone number, even. Where do we go to get involved?
So, first of all, website is campbell-foundation.org. We are on LinkedIn, Instagram, Facebook. We are especially active on Instagram and LinkedIn. So LinkedIn is just Campbell Clinic Foundation. At Instagram, it is Campbell Foundation it's Campbell Clinic FDN. But, when in doubt, just email us at info@campbell-foundation.org. But we have a, regular e-newsletter. We've got a print newsletter. We've got lots of social media, and we have an active calendar. So there's lots of opportunities to jump in, engage, and throughout the year we have other special events, guest lectures, that we are the beneficiaries of the Turkey Trot, thanks to Start to Finish for the last 2 years. And really just want to see how many ways we can partner with the community, because the impact on each and every one of us is greater than I think most people realize.
Absolutely. Well, Jenny Koltnow, thank you for all you and your amazing team at Campbell Clinic Foundation do to power the good. Thank you for coming on the show.
I'm happy to do it. Thanks, Jeremy.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.